Welcome to the Medical Maverick Show, where we search out the best of the best doctors and dentists in their chosen profession. Every week, we turn our spotlight on breakthrough medical and dental treatments that can provide you with the best possible care you can get. Thanks for stopping by, and enjoy the show.
Hello, everybody. This is Eric Batty, and I'm your host today on the Medical Maverick Show. And on today's program, we have a special guest who's going to speak with us about Fastbraces and how you can get your teeth straight in as little as 6 months. I have with me Dr. Mark Stephenson with Colonnade Dental in Raleigh, North Carolina. Dr. Stephenson, thanks for taking the time to be on the show today.
Thanks for inviting me.
Good. We're looking forward to speaking with you. So go ahead and tell us a little bit about yourself, your education, and what got you into the dentistry field.
That's a good question. I'm not one of these people that grew up wanting to be a dentist. I was business track. My dad opened a fast food restaurant. I left school to help him with the restaurant for a while, and that convinced me, boy, you need to go back to school and become a professional something. And I decided that, good with my hands and like people, and dentistry was a good fit. So I went back to UNC-Chapel Hill and finished out my declared chemistry as a major, because that sounds ridiculous to some people, but chemistry is the easiest path to get into dental school because they require 10 chemistry courses. So got my chem degree and then got into dental school, and I've been out for an eternity now, 29 years.
29 years.
Yeah, hard to believe.
Wow. All right, well, before we get into our subject today, let's talk about all the services that you guys provide there at Colonnade Dental.
I'm a general dentist, so that means I'm a jack of all trades. I do just about everything that dentistry has to offer. And in fact, just today, as a good day, I did 3 implants on a gentleman this morning, and I followed that up by starting an orthodontics case, a Fastbraces case on one of my patients that lives nearby. But I do all the general dentistry, cosmetic fillings, cleaning teeth. I do root canals, crowns, bridges. I also do clear correct braces. Not everybody here is a Fastbraces patient. I do some people like the clear aligners because they're...
And that's similar to the Invisalign then?
Yeah, clear correct's a direct competitor to Invisalign. And most people know that Invisalign name. Clear correct's the same thing, and they're a nicer company to work with because I can make course corrects along the way, and they allow that, where Invisalign is just hard to deal with.
A little more limited.
Yeah.
Okay, so well, let's why don't you explain the difference between traditional braces and the short-term orthodontic? Well,
if somebody's looking at them, it'd be difficult for them to tell there's any difference at all. And if I put braces on one of the on a 15-year-old, and his parents look at them, and they say, well, they're braces. Well, yeah, they are braces. Right. We have both the metal versions and the ceramic versions that are difficult to see. But the way that the Fastbraces system was designed by a guy named Dr. Viazzi, who's out of his offices down in Texas, and he had when he went through orthodontic school, they teach the orthodontist to use different wire sets as you go. And the first thing they're trying to do is make the teeth look good, and then they're going to try to upright the roots to make them match the alignment of the teeth. And they do it in sort of a staged process. And his idea was, why can't you do both at the same time? So he designed the brackets to do exactly that. So we're aligning the roots at the same time we're aligning the crowns. And since you're doing them both at the same time, it shortens the length of time it takes to do orthodontics. There's nothing magic about it. But he had to design the brackets to allow that to happen. And then he did thousands of cases in the Dallas area. I think Dallas is right. In the Dallas area to prove beyond any doubt that you can do that without causing any sort of a complication. And once he had done that over about a 10-year period of time, then he started training general dentists like me to use his system. So the Fastbraces, it's traditional orthodontics. It's a custom-designed bracket that Dr. Biazzi came up with himself, and it's a really nice system that and one of the reasons I like doing Fastbraces and will always do Fastbraces, because I don't have to. I can buy the same brackets all the orthodontists use. But the reason I like it is because there's a team of orthodontists behind. They double-check everything I do, every step of the way, every case. And, once in a while they'll call me up and say, hey, you put that bracket slightly in the wrong place. You need to give them back and then move a bracket a little bit. And I like having that, somebody watching as I go and keeping me from making a silly mistake. So it's a good system.
Yeah, that's what I kind of understand, that versus the clear aligners, that you've got more you've got more ability to adjust along the way. Is that correct?
Well, clear aligners, they're good for some cases. It's hard to rotate teeth, for example, with a clear aligner, because if you're trying to move teeth outward or pull them inward or make some very small corrections in the rotation of teeth, you can do it with clear aligners. If you're trying to do something where teeth are badly misaligned, clear aligners can do that in theory, but you're talking 2 years. It takes a long, long time. There's no substitute for putting brackets on a teeth and putting wires. Have a wire to for the teeth to try to follow the arc of and that nice straight alignment. And the wires are just simply more effective. The thing that Fastbraces does is I put brackets on one at a time, just like the orthodontist, every orthodontist in the world does. I pick exactly where I want it to go. I pick the height that I want the bracket to be. I pick where I want it on the tooth to allow it to rotate the way I would like, and I can change those positions, whenever I see fit. It's a very open system, and it gives me a lot of ability to change teeth and move them where I would like them to go.
Right. Yeah, I can see that the advantage is there. Is there any kind of disadvantages that the treatment may have, or any potential, damage that may happen to the teeth?
None that I know of. None that I've found. The only thing that I have come across since I started doing Fastbraces is it's faster than I thought it was. I had a little girl the other day. The orthodontist told her 2 years, and I told her I thought it'd be 9 months to a year, and we took her brackets off in 5 months. And,
oh wow!
Oh wow is right, and they were just absolutely perfect, and I couldn't believe how fast her teeth moved. And we actually had her in complete alignment in 3.5 months. I just left the brackets on for another 6 weeks just to do it, so they could stabilize, and gave her retainers, and they've stayed right there. They haven't moved at all, and she's thrilled. So,
I bet. Now, what other factors would determine that length of time, especially in adults that are doing the treatment?
Well, the teeth move faster in kids than they do in adults. That's just because their bone is sort of dynamic anyway. They're growing. The teeth in a teenager are sort of settling in at that time, and sometimes when you catch the kids when they're 12, 13, 14, 15, teeth just want to move. If you give them a little push, they'll go. So once people get beyond 20 or so, the things get set in your ways, not just in your lifetime habits, but in teeth as well. But they still will move. It's a little slower, but you can still. In fact, I had several patients that are late 50s, early 60s right now, and we'll get there and make them look absolutely beautiful when they smile.
Yeah. Now, as far as any other factors that would extend the time that's necessary for treatment, for instance, I went through the treatment myself. I had space teeth, and it took a little bit longer. What can a patient expect, as far as what may be different about their case that may cause that to be a little bit longer or shorter?
Longer or shorter? One of the hardest things to do is to close when your front two upper teeth have a big space. That's very difficult to close. I find those take a long time. And I used to look at those and say, well, that'll close at 70 millimeters. It'll move so far every month. And no, on those two teeth, it's twice as long. It just they had separated for a reason, and you're kind of fighting whatever got them apart. But most of the other ones tend to move about as like I think they will. Teeth that are dramatically rotated are sort of hard to get in line sometimes, and canines are hard to move sometimes.
Right.
But, I kind of take that in stride when I see a case, and what can look simple, but this canine's got to move a little bit, and where I might say 6 or 8 months to somebody else, for them I might say a year, and it's rarely that long, but sometimes I have them that go as long as a year.
Okay. Now, what is the typical treatment schedule, and how often do the patients come into the practice to be treated?
Typically, and we don't do this for everybody, but we do it for 90% of the people. You start out and you get 4 brackets. You get the front 4 teeth on top, which is a great way to start. It starts to align those teeth up early on. But the biggest advantage of it is when you just have 4 brackets and they're right in the front where you can see them, you get used to what it takes to keep them clean and maintain them and brush around them and floss and see how what it takes to maintain the hygiene there. And then you come back in 5 weeks, and we make all of our appointments, almost all of them. Most of them are 5 weeks apart. So 5 weeks later, you come back, you get all the rest of the brackets, and you sort of know how to take care of them at that point. And then every 5 weeks they come back, and we make adjustments as necessary.
Gotcha. Now, what could a patient expect in regards to any pain or discomfort during the treatment?
If teeth are really misaligned, the first time you put these on, and I've got the arch wire that the teeth are trying to line up across, some of these things look like a stock market graph. It's just up, down, up, down, up, down.
Right.
And that puts a lot of stress on teeth. So they can be, severely sore is very rare. Some people are really sore. Most people, it's sort of a mild irritation, and they can take a couple of Tylenol a couple times a day, and they're okay with it. And 2 or 3 days out, it's okay. And as the teeth start to line up, that becomes less and less of an issue.
Gotcha. So what about any other health issues or allergies or anything that may have an impact outside of the treatment?
None that I know of. Brackets are pretty benign. They don't really cause any problems. I'm not going into the teeth at all. They're sort of bonded to the face of teeth. You don't change the enamel at all. Outside of just trying to keep them clean and keeping up your hygiene.
Right.
Yeah, I prefer people not to eat certain things like.
I was going to ask you about that.
Yeah.
What type? For instance, what kind of foods should be avoided? During the treatment.
You'd probably find caramels are tough. They want to stick in the brackets. It'd be hard to get it out of there. And I think the only person I've had that really annoyed me, this kid came in and he had ceramic brackets and he was missing 5 brackets when he came in. I'm like, what were you doing to break 5 brackets off? He says, I was cracking pistachio shells. I'm like, that's just perfect.
Yeah, that'll take care of it.
Yeah, I couldn't understand it. It just popped off. Well, yeah.
So you got to watch that. That's for sure. So what about what do you recommend for the care of the braces and oral health during that treatment? What do you recommend the patients do?
Well, we give them a brush set and a floss threader some nice little and some little tiny brushes to get around. You can do it manually like that and keep them nice and clean. And some of these kids come through, and I tell you what, they keep them so clean, it's amazing. But water picks are great tools too. You can go down and get a water pick at Target for like $40, and well, that's a big help.
Yeah, I bet. What could patients expect post-treatment, and what further care is needed to maintain the straight teeth?
Boy, there's the world's best question for fast braces. You mean after you get them off, you're talking about?
Yep. Once you're done with the treatment, they come off, and maintenance of them and keeping them straight. Yeah, well, because the roots and the teeth align at the same time, usually when they come off, the roots are in just about an ideal spot, and the teeth don't tend to drift. So we make retainers for them on the spot and try to give them to them within 2 or 3 hours so they can pop them in. But as long as the retainers come in and out easily, you know your teeth haven't moved. So I have people wear them for 15 minutes in the morning. They just put the retainers in and jump in the shower for a while and get out and get dressed and take the retainers out and rinse them and stick them back in the box. And as long as they put them in the morning and they're comfortable and they're not hard to get in and out, you know your teeth haven't moved. So we make 2 sets of retainers for everyone. And what happens for most people is 6 weeks out, they start doing that twice a week, and 3 or 4 months out, maybe once a week or even once a month. Just try them in, and make sure nothing's moved. So and Fast Braces does something that nobody else does in the orthodontic world. They have what they call a lifetime satisfaction commitment, which means, let's say you have braces, you do fast braces when you're 15 years old. And down the road, now you go through college and you're out in the professional world and you're 30 years old and you look and your lower teeth aren't perfectly straight anymore. You can go to any fast braces dentist. It doesn't have to be me, or it doesn't have to be the one that you started with. Go to any dentist that does fast braces, and you can have your braces put back on and straighten those teeth back out and get a set of retainers, and it's a guaranteed rate. It's about $1,000. So, wow, that is interesting. So yeah, anybody that moves or changes locations, that's very interesting.
Yeah, they can come back here, and it's written in the contract, and it's like $1,050. I don't know the exact number, but it's less than $1,100, and this is good for. There's no limit to it. It's 10 years from now, 20 years from now. But yeah, fast braces isn't going anywhere though. It'll be around. So.
As far as financial options and is there any insurance coverage? What do you provide your patients as far as that?
Yeah, anybody that's got orthodontic coverage, we take their insurance, and also we do care credit for some people just like to pay the thing off and do care credit payments, and you can spread that out for 2 or 3 years if you want to. But typically, orthodontics is one of the few things you can do this with for any dental office. But let's say I have a 9-month. I think case is going to take 9 months. We try to get $1,000 deposit, and 9 months might be. I'll just throw out the number $4,000. Let's say I'm going to charge $4,000 to do the case. They give me $1,000 up front, and then that leaves $3,000, and we just divide it into the 9 months and let them make 9 payments.
Gotcha. Okay. Well, great. Mm-hmm. Well, we appreciate you being on the show today. If our listeners want to learn more about you and Colonnade Dental, how can they get a hold of you and get more information there? www.mstephenson, which is M for Mark, MSTEPHENSON-DDS.com. All right, great. Well, so if you guys are anybody in the Raleigh-Durham area, be sure to contact Dr. Stephenson at Colonnade Dental for all your dental needs. And that's going to be about it for this episode of the Medical Maverick Show. We want to remind you to stay informed, feel better, and live healthy. Thanks, everybody.